Alright, so we're here with the new OCT. Keep in mind that we've only had this for about a month, so we're all still learning on it. So we have Michael's details here in the system. So what we're going to do is we're going to do a new exam on Michael. And we are going to do, first of all, we're going to do the OCT. And we're going to have a look at the macula. So let's set this up here. I'm just going to wait for this to start. So it's still going. Alright, so we're all set. So on the interface here, we've got a whole bunch of options here. So it's calibrating right now, and once that's ready, it's going to give us some of the options here. So we are first of all going to have a look at the retina, and we're going to look at. Actually, let's have a look at the optic nerve first. So maybe we'll do a section of the optic nerve head here. So we're going to set up Michael here on the machine. And what we're going to set him up for is for the right eye. And what we want to do is just set this up so that we're getting him looking at the little target there. Can you see the target there? Mm-hmm. Okay, so I just want you to look right at that. And if you look at the screen, you can see the optic nerve coming up there. And there's a little focusing button on the back here that you can play with just to get the image quality a little bit better. As you move it around, you'll see the image popping up on the screen there. And when you hit acquire on the unit down here, it'll automatically take the image when it's good enough to actually take. So if you tap on the acquire here, you can kind of see the machine there going through the motions of acquiring the picture. And on the bottom screen here, we try to keep it inside the four blue corners there. And as the scan is happening, Michael will see a little line going through his vision, but he's looking in exactly the right spot right now. So it'll stop automatically when it's done. So there you go, all done. So then what we can do is when we hit the X up here, it saves the picture and then pops us out to the screen here, and we can click on the image here. So for the OCT, we're more looking at nerve fiber layer thickness, so slightly different to the HRT. And as it's computing the data, it should give us the option to look at either a 3D rendering. We can also look at the raw data as well. But again, my biggest beef with this instrument is that it does not give you a standard deviation, so you don't really know. So you can look at this as a 3D map, which is kind of neat. You can zoom in right on the nerve, and we can go through it section by section, and there's a fair amount of detail there, which is quite cool. But in terms of a visual, it's useful. Diagnostically, okay, it's more useful actually having this for the macula if you're looking for macular like CSR or stuff like that. But if you go back to the thickness profile, thickness map here, you can see that you can actually get an indication in microns. You can move this central spot around to put it right in the middle of the disc. You probably want to hit this to save it, and then hop back in to kind of get a recalculated map. So when we hit print preview on this one, print report, on the preview you can see that it actually gives you the printout, tells you the thickness of the nerve fiber layer and the volume as well. So this is good from a baseline from a retinal nerve fiber thickness standpoint. And the map out here, you can see that red is a thicker nerve fiber layer, and as you move more into the green, it's a thinner nerve fiber layer. So again, you're looking at glaucoma from a different perspective. Now if you look at this from a macular perspective, when you're taking the image, it's basically the same thing as what we just did. The only difference is from a macular perspective, if you look at the macular, here's a scan that we did earlier with Michael. So if we look at the 3D scan of the macula, what's really neat about this is we can really get a good idea of the macula. I love the OCT for the macula. Definitely very, very, very useful in terms of seeing cysts. But you get very good detail in the macular zone. Not as big a fan of the OCT from a glaucoma standpoint. And again, a lot of that comes down to a matter of opinion. But again, my biggest problem, if you have a look at the printout over there that Michael has for both of his eyes, in terms of the nerve fiber layer printout, there is no indication of the standard deviation of the scan. So we don't really know, in terms of change, statistically, can we look at that change numerically and say we have a standard deviation of 20? If we see change of 150 microns, then there's statistical significance, but then there's clinical significance. So my viewpoint on clinical significance is I want to see a change of 5 standard deviations or more based on the noise of the instrument, and that's very tough to do with this. It's very easy to do with the HRT. So I think both instruments have pros and cons, but ultimately it comes down to the quality of the image attained regardless of what instrument that you use. Right now I think if you want a jack of all trades and a master of none, that's particularly good at macula, the OCT is not a bad option. Personally, I'm more leaning towards the HRT, especially now that you can tie the HRT into a visual field machine and actually get a structure function map. So I think if you're doing a lot of glaucoma in your practice, I still think the HRT is the way to go. I think the OCT is gaining a lot of notoriety because, first of all, it's covered for ophthalmology, so they're all talking about it. It's not covered for us, which is a real B for me. But I think in terms of the OCT, it's certainly not bad at monitoring from a glaucoma standpoint, but I just don't like the fact that we cannot quantify the noise of the scan, which ultimately depends on the user, which we all know probably outside of an optometric setting, even sometimes in an optometric type practice, the user will probably be a tech and not necessarily the doctor. So I think it's important to realize that probably the quality of the image is more important than the instrument used.